Coming up today, brain on fire, the rare condition giving one young woman frequent seizures, and the special implant giving her life back. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Rebha Chalise's life changed suddenly one day in class in college. She was healthy, active, until she suffered what doctors at first thought was a stroke. It wasn't. It was a brain infection that nearly took Reba's life.
Come on, doggies. Let's go upstairs.
This family trio is close, but when Rebha Chalise was away at college years ago, her parents received a call that their only child had suffered a stroke.
I apparently was in one of my favorite teacher's classes and I just fell sick. Just took me to the hospital.
Reba still has a hard time remembering.
She complained that she was half numb on the left side and she could not talk properly, slur, and they thought like, well, she had a stroke.
She had an MRI and neuro workup, but still no clear answer. They turned to the neuro team at the University of Kansas Health System, where doctors diagnosed Reba with NMDA encephalitis, an autoimmune disease that causes rare inflammation of the brain due to the body attacking itself.
She just seemed to get worse, like she was losing her energy. She wasn't able to stand up. We knew it's not a stroke because, it was getting worse.
At one point, she was put into a medically induced coma.
We didn't even know whether she'd survive at that point.
Her condition did eventually improve, but encephalitis left Reba with constant seizures, limiting her ability to work, live on her own, and remember.
This has been a long journey. So her encephalitis happened 2012. She went to a lot of rehab and she got to a point where she's doing way better.
It wasn't until 12 years later, epileptologist Dr. Carol Ulloa at the University of Kansas Health System was able to offer new hope with a procedure called a responsive neurostimulator, a surgical implant that helps limit the amount and length of seizures.
They'd do my laundry, they'd feed me. I didn't really have to do anything.
Not anymore.
Now when you're living by yourself, you have to do those things for yourself.
At 31, it's finally given Reba the independence she's worked more than a decade to achieve.
And we are so glad to be talking with Reba this morning alongside her parents, Robin and Archana. They are joining us live from their home today. Good morning. How are you all doing?
Good.
We're good, thank you.
Good to have you. Joining us here in studio is Dr. Carol Ulloa, an epileptologist and the director of the Comprehensive Epilepsy Center here at the University of Kansas Health System. Across from me is Dr. Murtaza Khan, also an epileptologist, but also a neuroimmunologist. And so we're glad both of you are here to just talk a lot more about epilepsy. We know this month is Epilepsy Awareness Month, so lots to talk about, lots to offer. But we also know what families and patients go through, so we want to explore that. Robin and Reba and Archana, take us back to that day in class when this happened. What do each of you remember?
The last memory I have of being in college was not even 2012. It was my freshman year, 2010. Pretty much the first semester. I don't remember anything past that. I just see pictures. I'm like, I don't know what I was doing.
Wow, that must be a strange sensation. What do you remember, Archana?
So Jessica, we remember getting a phone call from her friend saying that Reba's not doing well and she's taken to the hospital. So me and my husband, we drove over to Oklahoma but at that point we did not even imagine what we would have to go through and what, we haven't even heard about this disease, so we really didn't know what to expect.
Robin?
Yeah, we were not sure like what's going on because her condition was something that doctors were not aware and doctors were just trying to understand what's going on. So, there were a lot of uncertainty between ourselves and also the doctor or the medical professionals.
So at first it was thought to be a stroke, maybe even MS. How did you find out that it was actually this autoimmune disease?
So Jessica, after we brought her home from Oklahoma, She did go to Shawnee Mission Medical Center briefly, but they transferred her over to KU Med. And I believe, with the MRIs, the tests, and they did a lumbar puncture, and it took at least a week. Then they gave us the diagnosis of NMDAR.
Yeah, to add on Archana's point, Jessica, like I believe at the time there was a Professor Dr. Grunset. He had briefly heard about this NMDAR at his conference down in Louisiana, I believe so. And he was not certain, but he said like, well, there's this kind of disease that he had heard, but he didn't know for sure. So that's lead to understand or to see like if she had NMDAR, and if eventually it was. So.
Yeah, I think he had a clue, her being such a young girl, and this is a disease that occurs mainly in females. But without all the tests, he wasn't able to give us a definite diagnosis. But, when he talked to me the second morning that Reba was transferred to KU, when I recall his conversation, I think he had kind of an idea what was going on, but obviously he needed all those objective testing and all to give us a definite diagnosis.
There were several months, though,
Yep.
Reba stayed in our ICU. Robin and Archana, this was really the scariest time. At that point, what were doctors telling you?
Jessica, I don't know whether they knew what the outcome would be. With the disease, there were other critical, sometimes her heart rate would go right up, drop down, other things that they had to manage with this critical condition. It was relatively new, so as far as they didn't really know much about what her outcome would be.
And this has been an over a decade long journey. And so just to see Reba, you sitting here between your folks, just doing well, is so glad. I know you've been through so many different, down so many different roads, but what do you remember about the symptoms? What kind of symptoms do you remember having, after you were out and you were doing rehab and you were trying to get back to life? What were the seizures like? What kind of symptoms do you remember having? And I'd like to hear from all of you, but Reba, we'll start with you.
Honestly, I don't remember anything because it's affected my memory so much that I don't know how to word this, but if I don't find something significant, it just doesn't stick in my memory. So the only thing I can relate to seizures is not feeling good and then randomly calling my parents. But other than that, I really can't remember anything.
So you start to not feel good, and then that kind of tips you off that maybe you need to call mom and dad, that maybe a seizure's on its way.
Yeah, so the only thing that I can, that I have like predicting a seizure is maybe my head will go numb and I'll start tingling. And like I said, when that happens, I'll usually call one of them and then my memory just goes blank.
Archana, what do you remember about these seizures? What have they been like over the years?
So Jessica, we do notice, like her sleep patterns, maybe, she's off what her regular baseline is. Maybe there's even more confusion, and maybe repeatedly asking stuff. Also, I notice, I don't know whether it's like the lack of sleep that triggers these seizures. Moody, maybe the mood also, she becomes more moody. So we kind of look out for those things.
Okay, stay put. We're going to talk with the doctors here to just understand a little bit more about this disease. And Dr. Khan, I want to ask you, it's called, the name is brain on fire disease. Mm-hmm. What's the medical name?
Sure. It is really a mouthful. It's anti-NMDA receptor encephalitis. And in a way that kind of encompasses the neurotransmitters and the pathway that the disease takes, I'm honestly more in favor for the pop culture name, Brain on Fire. It was termed, I believe, from Susanna Callan. She was a famous journalist who underwent the disease and documented all of her symptoms there. And I like it because it tells you it's an inflammatory process, like the brain literally undergoing inflammation, but also the firestorm of symptoms that the patients experience, like insomnia, memory loss, delusions, hallucinations, and seizures.
It's a very descriptive. It's just to the point.
Agreed.
And a lot easier to pronounce.
Yeah.
So connect the dots. This isn't epilepsy, but it causes epilepsy. So this is interesting because I always think epilepsy is its own separate diagnosis, but this is something that causes it. Explain.
Yeah, so what happens with these diseases is that there's an overactivity of the brain. It pushes the brain quite a bit past its baseline. When you're having your brain pushed past its normal limit, it can be irritable and you can have seizures as a symptom of that disease. Now, if that goes unchecked, that overloading of the brain with seizures can cause areas of the brain to be damaged. When those areas are damaged, they can then lead to seizures coming from those areas. So it's one of the symptoms, kind of develops its own disease process if gone unchecked.
So then, yeah, why is it? Go a little bit more into detail about why it's so important to get this diagnosed early, especially when it's something that, as it comes on, people are thinking, well, we don't know what it is. Even in some cases, the doctors are trying to figure out what it was back in the day. So, so why is that so important to get it caught quick?
Yeah. Now, I think our stroke colleagues probably would agree with us, but time is brain. So the earlier that you get the underlying symptoms under control, the less damage and preservation of the normal brain functions you have. So again, this can be very difficult to diagnose because their symptoms are so wide, but the early identification and treatment, really, our patients do well.
So, Dr. Ulloa, it can take years, as we've heard, to find the right diagnosis, the right doctor. You were, I think, the third neurologist that the family saw here at the health system. By the time patients reach a specialist like you, how desperate are they for answers?
Often vary. I think with Reba's case, the good thing was that she got the correct diagnosis. There's people, especially back at that time, that wouldn't have even gotten the right diagnosis. And so then that led to early treatment with medications that can reduce the inflammation. But despite all that, you know, there was still a lot of damage that was done and some permanent damage. And that permanent damage is what caused her epilepsy.
Reba brought up a point about having, or I think Archana mentioned about having this happen more often in females. Why is that?
Mm-hmm. Yeah, it's just a population for autoimmune diseases is unfortunately young females, and whenever we have people with, especially in our field, unexplained conditions that hit that age group, we have to consider autoimmune diseases being part of that.
So when I think of autoimmune disease, and I'm sure the audience may feel the same way, but you might think of like lupus or MS, rheumatoid arthritis. How common is it to have an autoimmune disease that attacks the brain?
Yeah, I think that's a double-layered question. So in terms of things like lupus and rheumatoid arthritis, those are very common inflammatory conditions that affect the general population. So I believe it's somewhere around 150 people in 100,000 will have those conditions. For encephalitis and even NMDA receptor encephalitis, you're talking about 1 in 1.5 million, so quite rare. The thing is, though, it's the population that we deal with, so it always has to be in our differential. It's kind of like thinking like cavities are on the differential. It's probably rare in the general population, but if you're coming in with a toothache, you have to consider it. So in the same way, even though it's rare, it has to be on our differential.
That makes sense.
Mm-hmm.
Archana, help us understand just what this has been like for your family, just this long road that you've been on to find answers and to find the right specialists. Just take us inside some of those difficult days.
Oh, sure, Jessica. So definitely, you know, we get exhausted and, you know, we come to a point, especially with Reba's seizures and her being on meds. I thought maybe, you know, this is it and we just have to live with it the best we can and try to control it. But it's always important that there's so many medical research going on, and we heard about this device, and you know, we were really hopeful that it would control Reba's seizures even more with the medication she's taking, and maybe we'd be more confident her in living independently.
Yeah, I know that was a big concern for you. Robin, I want to ask you about just getting back to the basics of for Reba. And Reba, please feel free to jump in at any time. We're talking a lot about you and your life, but you can jump in on this conversation anytime you want. Robin, talk to us about the walking, the eating, the speaking. What was that like? How were you coming together, the three of you, to try to get Reba kind of back to baseline?
Well, you know, Reba was a very active person, right? So during her school, you know, she did a lot of athletics, so she was good in tennis, doing a lot of things. So after this brain injury, she had to be in the coma for several months. Then she had to relearn how to eat, walk, and all those things. But you know, being a very strong girl, and I believe, like, you know, her internal motivation that she can do it, I can. So that lead her, like, she can walk, she can do a lot of things today independently, and she's still doing it more and more every day. Reba, I will let you add, like, you know, how you.
I like to run one thing I like to, and this kind of sounds mean, but when I do get upset at somebody, I like to go run and just pretend they're behind me. It makes me run faster and longer. Like I said, that's mean, but it works.
You got to do it works. I like that.
So
Reba,
Jessica, you know, after the coma, she was bedridden for so many months. So I think she had a foot drop. You know, there was a lot of things that the rehab places did. Like, I know they had plastered her foot, and eventually, you know, she got to standing up maybe 8 or 9 months, you know, after she fell ill. Mm-hmm. And then she did have her walk with the, like, you know, a gait belt and the cane. So a lot of, you know, therapists that we are very thankful for. Eating, I never thought eating would ever be a problem, at least for me. But, you know, she not only did she not have that appetite, but even the coordination to be able to pick up her food and put it in her mouth.
And then another thing that would happen is I would forget if I'd eaten or not. So sometimes I just think I already ate and then just not even worry about it. Now I can remember if I've had a meal or not.
It's just the little things that we don't realize.
Take for granted.
Yeah, exactly. That's exactly right.
Yes,
hey,
absolutely.
Reba, tell me about driving and working. Where are we at with that?
Okay, driving right now, I was able to drive for a while, and then I think I had 1 or 2 like minor, okay, they call minor seizures call outs. So I had a couple of those on the road, so they've taken me off driving for a little bit. But I do work at a super Target that's up the road. I'm still in college, so I'm just trying to get myself out of undergrad school and just trying to get my grades up a little bit right now. So I work there. I think I'm just part-time, and I'm just at the cash register right now, but that's going a lot better since the brain has, the chip has been implanted into my brain, not only because I can remember different details and stuff, but I can control my temper. So I think that's one of the main things that's helped.
That's a good thing. And we're going to talk about the implant here in just a second, but docs, I mean, how great is it just to hear, you know, that Reba's back to just working, finishing school, she's kind of reset and she's back on track, if you will.
I am feeling all kinds of things, honestly, because even though we see each other in the office and I know how great you're doing, just hearing it in this setting is very different. And I want to emphasize something Archana mentioned. I'll never forget the first time that I met them in the clinic. I was with Dr. Shamin, who at the time was a training fellow. And when we explained to them, you know, the diagnosis in terms of the epilepsy that came from the encephalitis and that there were treatment options for her, there was this excitement, you know, I think in the room, and also like a renewed hope, which I think we heard earlier. So it's very exciting.
Anything that affects the brain, you would think it would possibly affect the memory, but make that connection for us.
Yes, so the area that had permanent damage from the encephalitis was a region in the temporal lobes called the hippocampus. And so there was inflammation there initially, and then that led to scarring. And we could see the scarring on the MRI, and that's on both sides, the left temporal lobe and the right temporal lobe. And that part of the brain, its job is memory. So that's why Reba's memory is significantly affected.
And by the time Reba reached you, she had tried many different medications. which then made her a candidate for this RNS, this implant. Tell us about it.
So it is part of neuromodulation. So it is a brain implant. There was a lead implanted in the right hippocampus and one in the left hippocampus. And basically, the electrodes that are implanted record the brain activity. And then when they sense the very beginning of a seizure, they send an electrical impulse. And that can help stop the seizure before symptoms happen.
Let's take a look at the animation so we can see it in action. Can you walk us through this part?
So that is the battery, or what we call the generator. The surgeon makes a craniotomy, so removes a part of the skull so that the battery essentially becomes a part of the skull. From there, you see the two electrodes, and we can place the electrodes wherever the seizures come from. In Reba's case, it was from the hippocampus. And so then it's recording the activity. Once it senses the seizure, then it sends the electrical impulse.
So any testing specific that you need to do before you decide somebody's a good candidate for this, or before you actually do the implant?
Yes, it's basically the testing we do for everyone having a pre-surgical evaluation for epilepsy. So video EEG monitoring, which basically means the person is in the hospital with the EEG leads on their scalp, recording the brain waves, and we want to see a seizure so that we can pinpoint where it comes from. A really good brain MRI, and that's what's going to tell us if we see any lesions that cause epilepsy. In Reba's case, we saw that scarring in the hippocampus. And then neuropsychological testing, which tells us a lot about the cognitive aspects, but in particular memory.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can also email the Medical News Network. Information is there on your screen. So, Robin, Archana, tell us what type of changes you've noticed in your daughter since having this implant.
Yes, so Jessica, definitely I feel like her sleep pattern, her appetite, she just seems so much healthier. There is also improvement in her memory, we feel.
Robin, what do you notice?
Yeah, I see like she's been more alert, and she can have some reasonable conversation. Like, she can talk and discuss about a topic that she can go for longer. That's a big notice for us. And also I have seen that she had some memory improvement, that she can remember a lot of things than what she used to do in the past without this device.
Reba, what's it like having this implant?
Honestly, I'm not sure how to answer that question. I am not really sure what to say. I think I'm doing better. Like, that's what everyone says.
At work?
Well,
oh, that's a good point. Oh, go ahead.
Well, and that's what I was going to ask Dr. Ulloa. It's natural to ask somebody, like I've asked her a couple of questions about what's it like. Mm-hmm. So it's an unusual question, because how is she kind of help explain what she's feeling? She knows she has the implant.
Yes.
She sees that she's working. She sees that she's meeting some of these milestone goals, but it's hard for her to kind of put that into context.
For sure, and I think in part that's why I love hearing like what the patient themselves is feeling, and then also what the family thinks as well. But Reba, I think you said it earlier in terms of your job, how that's going better in school. And so ultimately we focus on things regarding quality of life, and so if you're able to remember some of these things that are more important to you now, and you're able to be more successful at work, those are all successes essentially.
What are some of the common misconceptions? Yes, go ahead, Reba.
Okay. That's what I was going to add, is at work they've been telling me things like, okay, you just know where things are, you know how to stay into what you're doing more, you know people's names more. So that's something that they've mentioned to me at work.
So she's getting feedback that it's working,
Yes.
and that's good. What are some
Yes. misconceptions
do people hear? Do you hear about epilepsy? What's out there that we need to kind of clear up?
Oh, there could be a whole show about that. I think, well, first of all, diagnosis can be challenging, and a lot of times people are actually diagnosed as having panic attacks or anxiety when it's actually epilepsy. Then misconceptions about treatment. So just, for example, that all that you can do is medication. And I do want to emphasize that medication is the first-line treatment for epilepsy. And for 2/3 of people, it works well, but for about 1/3, they keep having seizures. And so that's when you really want to see a specialist. You want to go to a comprehensive epilepsy center so you know what options are available to you. Other misconceptions: if you have a normal MRI, you can't have epilepsy surgery. That's not correct. And then things like a woman thinking that she can't have children because of having epilepsy, and that's not correct.
Dr. Khan, anything you hear?
Yeah, I think I would definitely echo those. I think there's the TV perception of what a seizure is, which is the big, like, shaking on the ground, and if it isn't that, it isn't a seizure. So we know that it can affect any part of the brain and cause those symptoms. So as Reba's been experiencing, even the feeling of unwell or something is about to happen, that can be one of those symptoms that can easily be missed. So education is key for this.
You all took a trip overseas, I understand. Tell us about how you were able to get to that moment, because this was a trip that you had planned many, many years ago, and you were finally able to take it.
I know that made her really happy. We were about to go and then I felt sick.
So Jessica, you know, before Reba had this device, you know, she was on medications. She was doing well, but we'd still have like episodes as well as she'd have these smaller episodes where she'd lose, you know, she'd just space out, blank out. Our main concern is we'd love to go overseas, but what happens if she gets, you know, sick and she gets a seizure?
I just need
and how do we bring her back home? So with the device, and we did monitor her for a few months, you know, we just felt more confident that, you know, it seemed better managed, as well as Dr. Ujola and her staff. They gave us some emergency medicine, which we could take that would help the seizures. So even if something did happen, we didn't end up at the ER somewhere else, and you know,
tell us something different, and who knows what they do.
So
yeah.
This definitely made us more confident.
So cool. You were able to finally make that trip.
I would say yeah, Jessica, let me add you there. Like, you know, our peace of mind, like we had emergency medicine that Dr. Ujola had provided us. That's peace of mind, right? But on top of anything, that what we say is like there is somebody watching her constantly. That's the device. So that was our peace of mind, that hey, even we are sleeping or something, or like, you know, anything, but there is somebody constantly watching her and trying to tell, hey, awake, like, you know, she may be getting seizure, it's time now to activate. So that's a big thing for us. That's a big.
Oh, yep. And before, even when we left her, dropped her off at work, I remember once I had come to pick her up and I saw like a fire truck, and I'm like, that's Reba. You know, my stomach just sank. But now we have very like, I'm not concerned like I used to be, I feel.
That's so good to hear.
I feel she's okay.
She's
With
okay.
anger management, that's been the biggest thing that's happened.
Hey,
So I can control myself a little more.
we could all probably use that, Reba. I get it. It's all right. I want to get to some.
Need it the most, though. That's okay.
Let's get to some questions from our viewers, because we've got a few here. Jeremy wants to know: are there parts of the brain that are more or less receptive to the stimulators from that stimulation from those implants? Because you said you could put it anywhere.
Yes. Oh, that's a great question. I mean, I guess we can probably both touch on this, but what I would say is the areas that were most studied with the pivotal trial, it was the temporal lobes, and so we know that those patients tend to do the best. But the electrodes can be placed in any part: the frontal lobe, the occipital lobe, the parietal lobe. But I would say temporal, we see probably the greatest success.
Gina's asking, is the area of her brain that is damaged the same area that causes deterioration in the elderly memory?
Yeah, there's different portions and they are intimately connected. It's a little harder to answer because you have areas that are responsible for, say, short-term memory, attention, and long-term memory. The areas that we're seeing damaged in this case is more short-term memory. So if you're not able to record those memories, they don't end up going into the long-term. So it's a whole circuit, not just one area of the brain that's being affected here with memory.
Stuart wants to know, is NDMA encephalitis, the actual infection. Is that an infection?
Not quite. Now, some infections can trigger it, but it's kind of the body's reaction to typically an infection, where it has an overcompensatory reaction. So if you have an infection, your body ramps up the immune system to fight it, but this one kind of is a more permanent change that goes or persists even after the first infection is there. So it's your body overactively trying to protect yourself, but causing collateral damage. That's the best way to look at it.
And then that's where that encephalitis then develops.
Correct.
Or comes to be. I want to just get some of our takeaways today, and I want to go out to Robin and Archana and Reba, and I want to ask all three of you, what do you want folks to take away from your whole family's story?
Yeah, Jessica, so I know, especially when it's a long-term illness like this, we do tend to, adapt to whatever and get exhausted, but I just want everyone to be hopeful. There's so much of medical advances, so, it's possible that there is help and we just don't have to give up and live with our situation.
You get what you can handle. If you're weak, you're not going to have something like this.
Okay, so first of all, I would like to start with thanking Kansas City Medical Center, where we were really treated well, and I would like to start with the doctors like Dr. Hussman, Dr. Lilly, Dr. Grunset, Dr. Amanda Thuringer, and Dr. Ujola, who were constantly watching Reba and listening to us. And I know there's a lot of moments that we may be asking too many questions, but they had a lot of patience that to answer us what's next and how to do it. And there may not be a lot of answer, but they still have patience to talk with us. And also obviously the medical staff, nurse, and everybody who had support us, and there were a lot of things that we done for Reba. And eventually, I would like to tell, science is growing. This is not the end. This is the start. We were fortunate that we were able to talk with Dr. Ujola and the team, and they were able to at least approve Reba's for this device. But I'm sure there will be more and more devices coming for the people for the future. Somebody may go through this kind of disease. So don't lose your hope. There's always, science is always evolution, and there's something coming up.
Thank you for sharing that. And as of course, we love to hear that you had a wonderful experience here and you felt great. But most importantly, we're glad you have your confidence back in your daughter. And we're so glad that, Reba, you're doing well. And we just want you to continue to be well. Dr. Khan, what's the big takeaway from this conversation?
I think knowing that this disease exists, so thank you very much for sharing your story, because I think it's educating the patients that, here are some of the symptoms to look out for, and the providers on the other side, hey, this should be under differential. So really appreciate you guys taking the time and sharing your story.
Dr. Ujola, big
Yes.
takeaway.
If you're having seizures despite taking medications, don't give up. Seek a second opinion, a third opinion. Make sure that you are going to a comprehensive epilepsy center where you're seeing a subspecialist, epileptologist, because that's the place where you will get the most information and you will see what your treatment options are and understand the risks and the benefits of all those options. Things change rapidly. Every year there's new things coming out. So if you had an evaluation 15, 20 years ago, there's so many new things right now. If you weren't a candidate back then, you're a candidate now. So never give up.
Thank you to all of our guests for being with us today. Thanks to our viewers. We'll see you back here tomorrow.
Coming up on the Morning Medical Update. After ringing that bell, the breast cancer journey doesn't end. It transforms. I'm Alexis Del Cid on the next Morning Medical Update, learning how to live like a survivor, hear how one woman is adapting to the challenges, the victories, and the new perspectives. Tuesday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.